What is peptic ulcer disease? Stomach ulcer is a painful disease that takes away the pleasure of eating and bothers you time and time again with severe and mild pains. Doctors who have been searching for the cause of stomach ulcers for a long time thought that factors such as eating spicy foods, stress, smoking and wrong eating habits, and taking some drugs were the only causes of stomach ulcers until in 1982 scientists discovered a type of bacteria in the stomach lining, and they realized that this bacteria is present in the stomach of many people. They named this bacterium Helicobacter pylori. What is the cause of stomach ulcer? Helicobacter pylori is a type of mobile and spiral bacteria and is considered the most important cause of gastric ulcer today. This bacterium often enters the body through food and water during childhood and can remain in the digestive system for years. About 2/3 of the world's population have this bacteria in their bodies without developing stomach ulcers. In some cases, this bacterium damages the lining of the digestive tract. The affected parts are exposed to stomach acid and turn into ulcers. If these wounds are treated late, bleeding, infection and inflammation will follow. Stomach ulcer symptoms. Stomach ulcer is always accompanied by severe pain. These pains are temporary and become more intense when the stomach is empty. As a result, the patient feels more pain between meals or during the night. Pains can last from a few minutes to a few hours. Of course, stomach ulcer has other symptoms besides pain. The following are the symptoms of stomach ulcer: flatulence, nausea, vomit, weight loss for no apparent reason, dark and black stools, dizziness, difficulty breathing, feeling tired for no reason, pale skin, vomit that contains blood particles, severe heartache. When a stomach ulcer becomes severe, it can cause stomach and intestinal bleeding. In such a situation, we should see a doctor quickly. Lifestyle changes and home treatment of gastric ulcer. Do not doubt. If you have symptoms of a stomach ulcer, see a gastroenterologist. After the examination and perhaps other clinical work, he first diagnoses, then prescribes the appropriate treatment. Along with the treatments prescribed by the attending physician, following will help the pain and symptoms of stomach ulcer to heal sooner. To treat gastric ulcer, have a healthy diet, include a lot of fruits, especially fruits with vitamins A and C, vegetables, and whole grains in your diet. If we do not eat foods rich in vitamins, the healing of stomach ulcers will progress slowly. Eat more foods with probiotics, such as probiotic yogurt, a little leftover and old cheese, red cabbage left in vinegar and kefir drink, a kind of fermented drink made from milk. Eliminate foods and drinks that aggravate stomach pain. We need to be more careful. Eating certain foods may aggravate stomach pain. Avoid eating these foods. These foods do not have a fixed list, and each person must find the foods that make his pain worse. Consider changing the pain medication. If you have been taking an over-the-counter pain medication for a long time for a simple pain, be sure to discuss it with your pharmacist or doctor. Maybe changing it to a pain reliever that doesn't affect the stomach will help the healing process a lot. Control stress to help treat peptic ulcers. Stress can worsen peptic ulcer pain. Find the source of your stress and avoid it if you can. Some stress is unavoidable, but we can make it less stressful or affect our health. Regular light exercise such as walking, writing down your feelings in a paper or digital diary, and spending time with good friends are some of the best ways to reduce the effects of stress. Stay away from tobacco smoke. The use of all types of tobacco weakens the protection of the inner layer of the stomach and thus, the person becomes susceptible to stomach ulcers. Smoking also increases the production of stomach acid. Avoid alcoholic beverages. Excessive consumption of alcoholic beverages causes damage to the inner layer of the stomach and intestines, and its continuation can lead to inflammation and bleeding. Get enough sleep. Good sleep is the biggest contributor to the body's immune system and an effective way to reduce the impact of stress. Stomach ulcer diagnosis methods. When we have a stomach ache, during the examination, the doctor examines the symptoms of stomach ulcer and inquires about the medical records and the medications taken. If you have symptoms of a stomach ulcer, you should do tests so that your doctor can be sure about the presence of Helicobacter pylori. If the tests confirm the presence of this bacteria in the stomach, the doctor will decide on the type of medicine to be used and the treatment of the stomach ulcer. Likewise, the attending physician may use endoscopy for diagnosis. How is stomach ulcer treated? If gastric ulcer is not treated correctly and on time, it may lead to stomach cancer. For this reason, seeing the symptoms, we should go to the doctor immediately to prescribe the right medicine for the treatment of gastric ulcer. During the treatment of gastric ulcer, it is better to avoid foods that increase stomach acid, such as pickles containing vinegar, and not to use anti-inflammatory drugs arbitrarily, because some of these drugs can damage the stomach lining. Most importantly, by improving the level of hygiene and access to clean water, we can see a reduction in Helicobacter pylori infection. What is the follow-up of gastric ulcer treatment? Gastric ulcer treatment is usually successful in healing the ulcer. But if the symptoms are severe or the symptoms have not improved despite using the treatment, there may be other diseases, and it is better to see the doctor again. Sometimes, the doctor may even request or perform a second test and endoscopy of the stomach. If symptoms have improved, some doctors use endoscopy again to make sure the ulcer has healed. We must remember that gastric ulcer is a very recurring disease, and in case of repeated symptoms, we should see a doctor. After re-examination, the doctor either renews the same treatment or prescribes a new treatment based on the existing changes. Avoiding food in gastric ulcer. Apart from quitting smoking, which plays an important role in improving and preventing the recurrence of stomach ulcers, there are some foods that are harmful to almost all people with stomach ulcers. Alcoholic beverages are at the top of this list. The rest of the items that are harmful for stomach ulcers and should be used with caution include fried foods, sour lemon, hot peppers, chocolate, coffee, tea and carbonated drinks or containing cola. Mustard seed. It should be noted that everyone suffering from stomach ulcers should be careful in consuming food, and if food aggravates their symptoms, they should be careful in consuming it. Therefore, for each person, other foods may be associated with exacerbation of symptoms.